I'm Luiz. I'm the manager of the hospital, and I'm going to talk about triage in a veterinary emergency with you guys. Just a little bit. I want you to like kind of get in with me. A little. It's going to be like more chit chat because this subject we need to be kind of talking and because it's subjective to each person. For someone, an emergency could be like red, and another emergency for other one could be yellow. Depends on the doctor. Depends on the technician. So let's start. You say, my name is Luiz. I'm born in Brazil. I was born and raised in Brazil. I did vet school and I graduated in 2018. And since there, I was working in Brazil, also in shelters, with ophthalmology and all those things. And in the middle of the pandemics, I decided to come here to the United States. Literally in the middle of the pandemics, was at the time was not that much like a good choice, but when I got here, yes, it was an amazing choice. So let's start from there. The first thing that we need to know is the difference between urgent and emergency. The main difference is kind of, for urgent, the dog no, but the patient is not like in risk of the life, so it's not life threatening. Can be like urgent and then need to be seen like soon, but it's not like life threatening. So the emergency, if another emergency is coming and it's life threatening, that's going in front of the urgent. So that's why we need to know those terms and see what the difference between. And technician, most of the time, technicians here do the first evaluations, not the doctors. So the technicians need to be really good to grab like some small details because sometimes the owner doesn't come with the whole history in an emergency, and they are always like nervous. They always like unstable. They was like always like doesn't tell you like the full history. So you need to grab the small details and trying to gather the information to choose between all the parts of the emergency. So here I have some examples of emergency: difficult breathing and choking, uh, respiratory distress for cats. That's a big emergency. So always bring him back. Don't touch. Wait the doctor because a cat in a respiratory distress can literally bite you and hurt you really bad. Put in the oxygen chamber and wait for the doctor, and then the doctor's gonna assess and see everything. We have the severe bleedings. Severe bleeding is bleeding. We used to say when it's like a main heart arteria or like a big vein. So we always need to evaluate how much blood has been lost or been lost before getting to the clinic. If the patient got here like unconscious and collapsed, so we need to evaluate what happened. If he had a seizure before, if it was just like a collapse, if that collapse came from a heat stroke or something like that. Here in Florida, we have tons and tons of heat stroke in the summer, so we need to take care about this. Also, if they came with pale gums, and also if it's like kind of cyanotic, that needs to be seen by the doctor like right away. The doctor will always be like, get inside and like, doctor, I need you, yell, because we need those doctors giving all the attention for that patient at that time. As I told, seizures and convulsions, also ingestion of toxic things like any kind of medication, any kind of drugs, they need to be seen fast as possible. Xylitol, it's one of the main things. In grape in the beginning, it's not like that emergency, but can turn into a really bad thing in future. So grapes, it's kind of just not super emergency. It's back there, but they need to be seen, check the glucose and everything to make sure it's stable for that time. Uh, any kind of trauma, if like a trauma that's also bleeding can come from a trauma, and if a trauma in the head, a trauma like hit by a car or something like that, it's straight to the emergency room. Put a catheter in both arms most of the time because we need to make sure. Heat stroke, it's one of those most things that we have in here. In the hospital, we've been seeing in the summer at least like 4 or 5 heat strokes, and some of the owners doesn't know because when you overheat, your system and their system doesn't show them they are overheating, they literally just collapse. You don't feel that you're going to collapse, you collapse. That's what's happening. So that's why it's so important to take care of them in the heat waves. So for urgency, we have severe pain distress. Most of the dogs and the cats, they are showing pain, but most of the time it could be like just a small pain, and they show like as a severe. Most of this like spoiled dogs, they are like this. So we need to take care. We need to evaluate and see everything. Like, is that like a pain that's being provided by some injury or some trauma? So we need to evaluate it to difference between the urgent and emergency. So that's why we need to always be all the sides and all the possibilities to take a look. If the dog it has inability to walk and some of the lamenesses, that can be provide came from anything that he ate or he have like diarrhea if he's dehydrated or something that can make that happen. Uh, there is a trick question for you guys. A fracture, a bone fracture, is an emergency or is not an emergency?
Just the fracture or a total
Just the
fracture?
fracture.
It's urgent.
Yeah, it's just urgent. Everyone thinks like a broken bone, it's an emergency, but it's not. Actually, only if it's the broken bone is tapped into a vein or an arteria, that's an emergency because we need to close that things. But the fracture on herself, it's not a thing. It's not an emergency. We need to take care because always when we're going to start the surgery, we're going to sometimes break the bone again to put in the place. So it's going to be restart all the cicatrization process. So lacerations and wound repair, most of the time provided by dog fights, cat fights, and they are if they are not like deep or they're not like bleeding that much, is not an emergency. It's just an urgency. Skin allergy, that doesn't like we saw a lot on emergency, and most of those clients they was like, hey, my dog is itching so much, but that's not really an emergency. We need to take care of all the emergencies before skin, the otitis and all those things. But otitis is also another thing. If you have like a really deep otitis, that could be an emergency because it's starting having like neurologic signs. So those neurologic signs can show us that we need to take care like as soon as possible. Okay. Uh, and allergic reactions causing for difficulty in breathing and swallowing. We need to take care because sometimes of the bee stings, they can make their face super cute. That's the most adorable part. But also, it's just a urgency, not an emergency if it's not closing the nozzle areas. So we can go for that. So the definition, the purpose of the triage is literally taking care of the patient and see how I'm going to assess the patient. It's going to be quick as possible or the patient can wait. Sometimes we got like one or two emergencies, like really bad emergencies at the same time. So we need to manage the team. So that's why we need to have a really good person who go inside to do the triage. Because sometimes if someone bring emergency asking if it, thinking that's an emergency, but it's not, it's going to just make our team split, and the patient who needs the attention at that time is going to have just have the attention. So we need to prioritize that patient that's with an emergency. Okay. So how the triage process happen? That's kind of standard, just a standard thing that can change for each different hospital. So our hospital does in one way, other hospital does in another way. So I just kind of gathered the patronize thing for everyone to understand better. So we need to gather the information. Sometimes information can, as I told you, with an owner that nervous, sometimes it's crying. So we need to evaluate what they're saying and what we are seeing at the same time. Sometimes they're saying, we got some nervous and clients crying that can barely say nothing to us. And then we need to get just the small information that we can understand to bring the dog inside, the patient inside, to assess all the vitals, to heart rate, respiratory rate, temperature, the CRT and the mucous pigmentation, and doing the full physical exam and everything to make sure that maybe it's not an emergency, so we can wait, just taking a look and be on observation. Oh, so determining of the level of emergency, we have 4 different levels. to patronize. So those levels should classify. Red is like a top critical emergency. The patient. I'm gonna keep saying the dog. The dog always come first in my mind. So the red is going to be to the critical patients. They go straight on the emergency room. The doctor needs to be there like as soon as possible to make sure the animal is gonna be passing through it, and we're gonna be able to stabilize him before getting any problems like health problems, future, or maybe death. Okay. The yellow ones that indicates the patient are stable, but required to be being seen like soon as possible also. But if we have another red one, so the red ones always come first. So the thing that it's always like we always try to do here is always when we got a new emergency and we have someone that's waiting, we go to that person's like, hey, we got an emergency. You now one step back on the line, so the increased time is going to wait. That's an emergency because a human emergency. We have green that usually those patients that came with skin problems, otitis, and all those problems that can minor problems that we can deal with 1 to 3 hours late when they arrive here. Okay, in black, unfortunately, it's for patients that get here like dead on arrival, and most of the time, like it's unlikely we're gonna can help him to survive because sometimes the patient just got here literally already dying in the process or dead, unfortunately. So that's the part that everyone's gonna work with me. Everyone's gonna chit chat. Is it an emergency or which color should I choose? Let's go with the first one. That's Max. Max is a Labrador Retriever, 5 years old. He has severe bleeding, pale gums, and rapid breathing. So he's panting so much. He was hit by a car, and he has a deep laceration on his leg. He's starting shock, or we're seeing already the signs of the shock. He needs immediate treatment to control bleeding and stabilize his condition. So if one of you gonna assess this dog on the lobby, which color you gonna choose? Red?
Red.
Red? You, doctor?
I suppose red can be appropriate.
Yep, also red. Okay, so everyone was really right. We have Luna. Luna is a domestic short hair, 3 years old. She was climbing a tree and she fell from that. And the owner saw she was limping and also with a swelling ball. So she looks stable. She's vocalizing probably. So how you choose the color?
Yellow.
Yellow? You, girl?
Green.
Green? It's a yellow. But also, as I told in the beginning, it's kind of subjective because depends on everyone how they gonna look into the thing. Okay. And if you do a lot of triages, you're getting better in the triages. So and also depends on the doctor on duty. For some doctors, we need to evaluate in different ways. Okay. Our third case, it's Bailey, golden retriever, 8 months. The owner gave her chicken wings. She's vomiting, she's have diarrhea, and we can see blood on her vomit. So, and that's happened 24 hours ago. How we gonna choose it?
Yellow.
Yellow?
Could be yellow.
It's a chicken bone.
I mean, you still have to practice
Yeah,
it,
I
right?
mean,
Yeah.
it's still 24 hours, you're gonna end up in x-ray at some point, but it's not.
Yeah. Let's see. But it's red. Because she's already lethargic and she refused to eat. So she's lethargic. She's probably losing blood inside. So that's why we need to evaluate that first. It's like,
Pale? Oh, didn't say she was pale.
no.
No, I just said diarrhea and vomiting.
Just say diarrhea. I'm sorry. I didn't say
Mhm.
Yes, it
I was
is.
gonna say, that changes everything.
Yeah.
Yeah, that changes everything. My bad. Okay.
It was a trick. See, he was just making sure we were paying attention.
Pale.
Yeah.
Pale gums, red.
Yeah.
No pale gums,
Yeah.
yellow.
Okay.
And also we can see in the abdomen if it's losing blood, we can see the bloat. So we need to evaluate all those things. That's as I told you, subjective. Everyone's gonna choose a different color. Oliver, Siamese cat, 7 years old, sneezing, coughing, and nasal discharge. He may have like upper respiratory infection that requires evaluation treatment to prevent complications. How do you gonna choose this color? Yes. Oh, everyone's good.
Unless he's not breathing.
Yeah. Who's Bella? Your child, 10 years old. She look like this. Super cute. Bella's having difficulty breathing, blue gums, and coughing up blood.
It's all purple.
Yes.
I was about to say,
Actually,
you
that's
have a
not
fucking
her.
black red.
Just like that's a bigger dog, but just to understand.
That was
Yeah. So she need intervention on her airways. So how are we gonna red? So let's gonna put like a layer of difficult now. So after we choose a red, what's the next step? What are you gonna do with this patient?
Oh, first thing first is oxygen, definitely. Oxygen, any such as vomiting, blood, so you need an ultrasound of her chest to make sure there's no fluid floating in there. Also, catheter, get some blood work, see what kind of fluid she needs, whatever. Possibly Lasix if it's her heart, especially with fluids in there. If she's breathing real bad, maybe a little, factory reset, propofol CRI and the ET tube and
Yes.
respiratory.
Most of those things. Milo, it's a Maine Coon. He has a swollen abdomen, difficulty urinating. Milo has while he was conditioned, I'm sorry, I'm just reading. A swollen abdomen, having difficulty urinating since last night. He started last night. So they came here like 8 a.m. So how are we gonna choose this color?
Well, if it just started last night, it'd be yellow.
That's
Right.
red.
Yeah.
Yellow.
But let's add another layer.
Mm-hmm.
He's been like this for 3 days.
Then it's yellow.
That's right. And what are we gonna do?
You gotta sedate, put in a catheter, urinary catheter, IV catheter,
Yes.
and get him a blood.
Yes. That's how we're gonna proceed. Rocky, it's a boxer, 3 years old. Rocky was gone for a couple hours and he come back with multiple lacerations. We don't know what happened, if he was fighting, if he was just into the woods trying to, being a dog. But he's alert and responsive. We don't see like a lot of bleeding coming out. We just see like some spots of the blood. And how are we gonna do?
I have a question first. What color
Yes.
are his gums?
His gums? No, we don't have this information. Could be red.
I would say yellow because he does need attention.
Yeah,
It's yellow. So if his gums was pale,
it'd be red.
it would be red. And if you have a lot of bleeding, also it's gonna be red. And what are we gonna do in this case? We're gonna get him inside as soon as possible. And what are our next steps?
Subcute fluids, if he's losing a lot of blood, clean up the room with some saline and possible some B12 injections to help him.
Exactly. We're gonna start cleaning all the wounds, see if it's
How deep
they are, and see if they have pockets. And then we're gonna evaluate the doctor. Probably gonna start the surgery to do the sutures and close the wounds. Our 8th case is Chloe. It's a Persian, 4 months. She is unable to stand having seizures. The signs are, of course, neurological. It requires immediate evaluation and treatment to prevent further seizures and minimize brain damage.
Red.
What color?
Unable to stand now.
Yes. So in this situation, what are our next steps?
Always start with the catheter. He or she might need like some Valium injection or some medication to stop the seizure immediately and help cool down a little bit as well because they may generate a lot of heat from
Yes.
getting the seizure.
Yes, exactly. And the medication procedure depends on each doctor.
Right.
Cooper, it's a German Shepherd, 6 years old. Cooper has been vomiting, having diarrhea, and he's lost his appetitis. He requires evaluation treatment addressed to the underlying cause of the gastrointestinal distress.
Yellow.
That's only the history that the owner gave to us.
Unless you tell me what color the gums are.
Or how long has it been?
Yeah.
No, see, in the triage,
Yeah.
sometimes we don't do the gums or nothing. We just hear the owners telling the history about what's happening. So that's why sometimes we don't have all the information, and we need to kind of figure out by ourselves in the time.
Yeah,
What's his
'cause how long
medication?
has he been
Huh?
vomiting diarrhea?
What's his medication? Like on presentation, when you see the dog come in, like you don't get to really evaluate him, but you can still see him across the room.
Yeah, he's kind of good.
Oh, then, yeah, yellow. Needs to be seen, but
Yeah.
not dying.
So vomiting diarrhea has a lot of layers.
Lots
We
of
can put
layers.
a lot of layers here, but let's go to the next one. That's Lily, a hack dog, cheap, unresponsive, no breathing or heartbeat.
I think she did.
He might be
I
dead.
It's a cute that picture. just stretching. So which color we're gonna choose here? Yes, black. But that's cameras, and sometimes we need to be kind of psychologists to the owner at this time. So even if it's black, we kind of going to prioritize.
Well, you still have to
Yeah,
listen for the heart.
yeah, and do everything and see if the owner wants to start a CPR or if they don't want to start a CPR, and how long they kind of like no breathing, no heartbeat. So if it's more than 30 minutes, rigor mortis is already starting, so no chance to the CPR come back. But we need to be really responsible with those cases because the owner got here really upset, really sad, and they most of the time can't say nothing. So that's part of our job, kind of being psychologists of those times. So we need to be calm, show them we are calm, and explain what's happening. Put them in a room because they are fragilized to be in the lobby. So we're gonna put them in the room as fast as possible, and then we're going to explain everything and ask them to explain everything that's happened to us. Okay, while someone is already trying to do the CPR if they allow the CPR. Okay, those are 10 cases. Just I prepared today for this lecture, just kind of chit-chatting, just to understand how triage works, and if you has different has questions or like present any kind of disease or kind of create a fake patient to me, then we can realize everyone together how we're gonna do it, how we're gonna prioritize. Sure. Yeah. She's like, can I say yes? Sure.
Okay, hold on. Okay, so 5-year-old Labrador hit by car, happened, they got there within 30 minutes. Dog, yeah, I don't,
Okay.
okay,
You give the Labrador 5 years hit by car. Give me another sign.
He is still alert and responsive, but there's some bleeding and laceration from the body, and then he is started to bruising a little bit from his abdomen.
Okay. So
Okay, you can see it from like the skin and coat.
yeah, what that means to us, that means that we have like a bleeding inside.
Mm-hmm.
So they need to be assessed as soon as possible. It's going to be a red line.
Mm-hmm.
So it's going up on the line. But if he's like responsive and everything, we can see lacerations, just small lacerations, but no bleeding like inside with no signs of bloat or nothing. He kind of can walk. He can turn into a yellow. So we need to evaluate. You doctor sent someone to us today.
Yeah.
Can you share your patient with us and we're going to evaluate how we treat them?
Yes. So a 15-year-old cat name's Jack, only one eye,
Yeah.
and
It's a classic.
almost 16. The respiratory distress and abdominal breathing. So just rats to build the fluid. I was stable enough to be sent over. Doesn't need to perform emergency thoraco synthesis. So it's sent it over.
Yeah, he got here. He was kind of stable, difficult breathing, but he wasn't getting like payer or cyanotic. I'm sorry, just cyanotic. He was getting cyanotic. After we started the TPR, he was starting getting cyanotic because he was getting stressed by us. So in this time, he turned into a red. He got here as a yellow, but when we were handling him, he turned into a red. So we need to put him on oxygen and see what's happening and how it's doing. So to evaluate. So we did evaluate. The doctor sent also X-rays to us. We saw in the X-rays a little bit of fluid on the lungs. So the next step is going to be the thoracocentesis. So that's what we did. We took 240 from the left side and 25 mL from the other side. So after that, he's breathing way better. He's still in oxygen chamber just to make sure, but after 1 or 2 hours, if it's not like making more liquid, so we can take him out, evaluate the what's the name? Meaning? When we decrease the oxygen, I forgot the word.
Weaning.
Weaning.
Is the
We're going to start weaning the oxygen and until he get on 0 and see how he's perform. So that's how just happened here today. So just to bring it for you guys. And any more questions? Before you got here, I can do a really
Did you
cheap
try to work here?
rapid job with you. So, okay, so thank you guys for coming here. We're going to have a break, coffee break outside. Let's enjoy. Okay.
Have you here tonight to listen us like in the set the Proper Pets Academy now. It's the first I want to apologize because it's my first time talking in English to everybody.
Doing great so far.
Because I'm gonna talk about me a little bit, but I want to apologize because, of course, we are Brazilians and it's our second language, the English. So sometimes we make some mistakes, but we are learning every day. Thank you so much. So we are here to do a presentation for you guys about radiographs, ultrasounds, or CT. What we're gonna choose, what we're gonna decide to do, or which one is better than the other, right? So I'm gonna do a summary here for you, a brief introduction about myself. I'm gonna introduce you the questions that I make to myself when I'm in front of some patient that
When
we
you're
have to
doing triage.
use. Yeah, the triage. I don't do the triage. I worked a lot with work internal medicine, but now 25 years I'm doing just the images. So yes. So, but you're gonna understand. I'm gonna try to explain to you to understand which difference, like what you have to think about the difference between one or other. Okay. And the other thing that it's the last thing is like remember always do what you can. Okay. So my name is Simone Monteiro. Dallagnol. It's the Dallagnol is a little bit like more difficult because it's Italian. It's my husband's. So I prefer to do a little bit shorter. Simone Monteiro. So I graduated 1996 in Brazil, in Universidade Federal do Paraná. It's south from Brazil. My master degree is there too. So I was a teacher in 2 universities over there, like doing radiology, teaching radiology. I'm a wife and mom of a dog and a little boy, 11 years, Luca. So we have a lot of stuff to do. This 25 years dealing with the images and trying to explain to my students, I'm a little bit like how can I say? I'm very, very passionate. Like I love what I do. I love imaging. So this is something important because I can like sometimes make you guys a little bit more like interesting about the imagings. So the first things that I think, it's like when I have the patient in front of me or the doctor talking with me, like and trying to explain what you're gonna do, what do you think? It's the questions. What I need to see, exactly. What I need to see. So my patient is stabilized to do the exams. How painful is that? I need help to perform or I can do by myself, right? And I have someone to check the results now or no. I understand that kind of that type of exam that I'm gonna do or no. Or I'm just gonna do because I have fun, right? So money is a problem. So majority time of yes, right? So unfortunately we have to think about that. Those questions for me are very, very, very important because make me understand and put me in owners, like the owner's place too. Mm-hmm. So I'm trying to do my best. Again, the question that I told you guys that it's very, very important. I'm trying to do what it's possible to help. Okay? So what you're gonna check? You have to think, okay, I have to see the bones or the air or the fluid or a solid structure like that we have a lot, right? The foreign bodies. Or I want to check the general view, like just check something. Okay. Or can we do right now? This is the correct moment to do, or we can wait. Okay, so we have to think about that. Now we're going to talk about to try to understand the differences and the positive things and the negative things about each one of them. The radiographs, the positive points are the cost, because it's cost the less, right? It's quickie and easy, because you can do very quick. One person task on the majority of the time.
Sometimes.
I'm gonna talk about that too, guys. This is my favorite question about that. So most common, and I fight a lot with them here. So the most common, so it's the oldest, so we can understand and we know more about it, right? And we can do in the emergency, right? So the negative point is we have a lot of artifacts, so movement, right? Other thing had radiation, so we can't expose too much, or you or the patient, to a lot of radiation, correct? We need sedation sometimes, and this is my fight sometimes here, because we have to do our best, and I want to provide you the answer, but sometimes I can't if you don't sedate, because it's impossible, because the artifacts. So yes, and we have the negative points because the positioning and the training needs a little bit, but it's not too negative. Now, right? You can like do a little bit because it's some like 2 hours of training and you can do everything. So I usually put this to memorize like some facts that you use, like the A, B, C, D, E, F, G to the radiographs. So just to points that we have to remember why you're gonna use, right? So air, A, air, B, bones, C, chest, D, diaphragm, E, effusion, F, foreign body, G, GI, and general, and H, the heart. Those for me makes a little bit more easy, like especially the text, to understand like when they are in the beginning, like the students too. So my students usually ask me, A, B, C, D, E, F, G. So yes, okay, so what do we have? Okay, so this is my tip. And about the sedation, about the needing, like we need sedation sometimes. So we are here, the guys always I'm fighting against the too much exposition. So we have to remember we don't see the radiation, but it's there. So and you're gonna keep doing, and this along the time you're gonna probably could have something. I had thyroid cancer, so I don't know if it was the radiation, but I had a lot of radiation in my life, 25 years doing that. So I don't know if it was the cause or not, but could be, right? So I say to the girls like, don't expose, please, let's do with sedation. So okay, when we have like this to help, we have the tapes, we have the bean bags, the sandbags to use. And when they are sedated, use it. Don't expose yourselves. When they are sedated, they stay there. So you can do this kind of situation to help yourselves to don't expose yourself and don't repeat again like this the positioning and the dog again to radiation. Okay, so this is a quick tip that I like to give to you. So I put some examples and the A, B, C, D, F, G that we have like before. So the chest and the heart and the bones and the air, we have like everybody there. So this is something that we can see a lot and like we can do a lot. The chest is amazing to see, right? So the effusions, like we have like the lungs should be black and now it's white. So we have like a lot of some fluid there on the lungs, and we can see the air on the bronchioles here. So you can see the bronchioles dilated here. So you can see perfectly that. You don't need no other kind of imaging for that. Do you want to have a question?
I was like, have I seen those X-rays? Was that Yorkie?
Yes,
Okay.
all those are ours.
Oh, okay.
Yes,
I was
yeah,
like,
we have
wow,
our
that looks
past
familiar.
emergency. Yes, all of them are all patients. So unfortunately, it's too white, but it's have a lot of dots. So we know about that. So unfortunately, we have to check meds, and we can, in this case, big a lot. You can see in the radiographs. The air, right? The traditional DDV, right? So we can see, and it's very easy to use one view. Sometimes you can see just in one view. So don't spend too much time and do everything that the emergency has to do. Okay? So the fine bodies, right? So there is something there. So the stomach has something there. So yes, we have gas, we have something there extra. So we can see. And this is good. So radiographs are amazing, right? So we can do a lot. And here, what it is?
Looks like
I will turn off the lights for you guys to see better.
Yes.
like a
So here.
small Tupperware. Maybe like a sock. Maybe.
A sock? Okay.
It kind of looks like a
Crushed water bottle.
Right. Someone when I took the radiograph, someone told me that this is the AirPods case.
Oh.
Is that what it is?
Was that one?
No, unfortunately no. This is the case that the dog was peeing with blood.
Oh, that one. It's a
Yes.
huge bladder
So
stone.
yeah, a bladder stone, 2 bladder stones, and you can see here inside we have a little bit of like different kind of shades, like that. That it's the stone and the other stone, and if you see, we have a lot another ones here.
Yeah.
In here. So when we have this dog had like calculi in the kidneys too and the ureter. And the ultrasound was done too. So we have like the images of this in 2 kind of images. Okay, so this is not a good calculate, so, but this is cycloma, you know, like it's like the other problem that we can see in just one view. Like we can like identify like very fast, okay? So, okay, let's change a little bit to CT. So why I choose CT to talk about CT after radiographs? Because CTs are the big, better radiographs. So they are amazing. They are like they can the images are amazing. So it's a good chance to do like a plus, right? So okay, the positive points in the CT is the accuracy. So it's very, very good. So we have like for the bones, for example, we have like the accuracy to like 100%. The definition and the diagnostic and surgery planning. So especially to orthopedics. So when we have like orthopedic problem, I recommend sometimes instead use the radiographs. You have to sedate, you have to positioning, and if the guy planning to do a surgery, so you can choose the CCT because you're gonna be doing an extra. So you're gonna see something extra. I'm gonna show you. The negative points, of course, unfortunately, is the cost, the anesthesia. Some dogs or cats can't go to under anesthesia, so we can use it. And we need training to do, right? And it's a radiation too, so we have to take care too. So this, our machine here, it's something that it's very, very interesting because we don't have the very like big radiation scattering. So this is very good. So because of this, we use like the small machine here, so we can like use with the radiographs sometimes, and it's very good. So the CT, the indications are to the head, the thorax, abdomen, spine, and bones. And we have to talk about a little bit about the emergency and the elective CT. So the head, the fractures, the teeth, and ear and the sinus. The head is amazing for the CT. I usually recommend when they ask me, oh, can you see the bulla for me? So in the radiograph, can we do a CT, please? Because it's so difficult. It's so difficult. You have to position, you have to sedate to do a better view. If you want a diagnostic with the radiographs, you need to sedate because you have to open the mouth and put the beam like in the mouth. So you have to sedate. And if you have a sedation, right, why not to expose and like do the CT, right? You have to another answer and like more answers, maybe. The teeth, like fractures, again, the thorax, lung contusions, torsions, and mets. Mets, especially the ones that we can't see in the radiographs. If you're planning to do a surgery and you have like doubt, oh my God, so if maybe I have or no, I don't know, I'm in doubt. If the owner has the money to do a CT, it's amazing, okay? The abdomen, the spine, the disc disease, the bones, joints, and fractures, of course. And fractures here in neoplasia, we can like, the joint disease, sometimes we have like a bad joint disease that it's like completely deformed and you don't know if it's like, oh my gosh, maybe it's cancer too. So I don't know, maybe CT can help you, okay? So the emergency CT and then the elective CT. So CT, usually you do like when we plan, right, with anesthesia, we do it like before the exams to see if everything is okay to the patient and everything. It's like us, right? So, but sometimes we need to do the emergency. So this CT here, we have like, we can like scan the dog, like the entire dog, like when we have an emergency. So like a dog that was attacked or hit by a car. So we can like do just that to do and see what we can, okay? So this is something important. So here are examples for you guys. Look, this city here, we can do a 3D mode. So we can do this, and this, it's a static, like it's a picture right now. But in this city, you can like move this for you. So this is so cool, you know, like because you can move the head and see the head in any plane that you want. You can choose the slices to do, and it's very, very interesting. So we can see the bulla, we can see the fractures there, like you can see everything. So, and we have like the possibility to take it off the muscles and see
you
the
can like take the bones,
Peel
it
take
away,
the
like,
bone, like
peel
rip it
away,
layer by
yes,
layer by
peel
layer.
away.
Yeah, it's really
Exactly. So this is, if
That's
you want
cool.
to plan, yes, if you want to planning a surgery, like for example, if you have a big hematoma on the tissue, so you can remove, peel, and see those bone.
That's cool.
Yes, it is. Yes, it is. So here another example. So it's from books, but you can see like this is like abscess, like in the ear. So it's good because you can see if there is some affecting the bones too. So this is very important. The sinus, I like the sinus here. We have a fracture inside. So this to see in the radiographs, it's very, very difficult. You know, like it's, you can, but my
It's
gosh, you know?
Yeah.
So, and here we have like the sinus and the, you know, like the sinus, it's amazing to see because you can see if the bones are distracted or not. So this is very, very important. Especially here, we have a lot of fungus infections in the nose. So we have a lot of problems with this. This is like a exam from a friend that it's orthopedist there in Brazil. So he makes a lot of CTs to planning his surgeries. So Dr. Casagrande is here, for example, he gave to me these pictures to introduce to you. So you can see on the hip, so we have dysplasia very severe, and he's planning the
Is it the femoral head?
the femoral head, yes.
Yeah.
So he can plan perfectly the surgery and after the surgery. So he has a lot of good experience with that, and it's
Wow.
amazing. So I think it's a good idea to think about go the orthopedics for
Right.
CT. Okay. The ultrasound. Okay. So now, unfortunately, I have like a crush. So here is my favorite. But because I work a lot with this, ultrasound for me is fantastic because the image talk with me. Like it's amazing. It's something in, you know, the movement, and you can make like a puzzle. You know, like, and for me, the ultrasound for me is like I have to find the answer because it's I can't stop when I don't have the answer. So I'm very like this. So it's fast. It's the positive points we have a lot. Like let's face it. So it's very fast. It's no invasive. We can see the multiple organs, right? We can see the entire abdomen, and you can see like everything. It's diagnostic sometimes, right? So, and we can like help with cycles, like aspiration, and like, you know, cystos and feces, or collect the fluid in the belly.
Yeah.
So this could be very, very diagnostic. Emergency, and other thing that I'm going to talk about, the AFAST and the TFAST, and the negative points. Unfortunately, the gas, the tension and the pain. Again, here, the sedation, sometimes I have to ask. The painting, the motion, and we need training to do. Unfortunately, it's not something that everybody can do, but I love to teach. So everybody goes when I'm in the room, like, hey, you see that, you see that, you see that. So this is, I love to train people here too. So the A-fast and T-fast, it's not because it's fast, right? So everybody, and sometimes when they talk with the owner like about that, so they think it's because it's very fast. It is, but it's not, right? So the translation about the word is abdominal or thoracic focus assessment with sonograph for trauma or triage or track. Okay, so this is something very, very amazing. Dr. Greg Liciano, I don't know if everybody knows, is from Texas. He was the guy that introduced this method. So I had the opportunity to be in a lecture with him. So he is an amazing guy. He makes this training, and it's very, very fascinating the way that you can understand that something that it's an emergency, and you can like help the doctor to do something to cure, because sometimes you can like just to push the syringe with the fluid, for example, or you can like make like a diagnostic. So in 5 minutes. So this is something that it's very, very interesting. So I put here some images for you. Of course, I'm not gonna talk too much about how the images are or how we can see, but could be another thing. But we can diagnostic here a lot. I help the guys on the floor. Sometimes they need, Simone, can you do a fast for me? Or can you do a T-fast? Yes, because sometimes helps where you're gonna choose where you're going, right? So this is very fascinating. So the ultrasound is very important. I diagnostic here some masses on the chest that they were not seen in the radiographs, nodules. So we can do a cytology. So this is very, very cool. Okay, so the best friend in the ultrasound, remember guys, is the fluid. So everything with fluid, it's the ultrasound. Everything with gas is the radiographs. Okay, so remember this is the best friend is the fluid. So everything that is fluid in the ultrasound is black. The ultrasound is about waves, sound waves. So the waves coming through the tissues, in different tissues, in the different substances. So here we have the fluid that is the frame of the ultrasound because it's the best material that the sound is traveling. Okay, so remember when we were kids, when we are under the pool and we go like, let's talk about it under the pool, like, remember that? So why we don't understand, but if you remember, it's very loud. The sound is very loud, but it's not understandable because the gas, the bubbles, you know? So here we have the gas doing the reverberation. Oh, sorry. The reverberation is the reverberation is something that I usually to my students keep in mind. I keep saying that they have to think the sun through the clouds. Okay, I'm gonna show you a picture. And when we have like the super hard structures that like a foreign body, for example, remember it's gonna the wave come and like
Crashes into it, yeah.
crash into and come back, not gonna pass. So it's gonna be doing a very big hard shadowing for me. So this is the differences. So the gas is passing a little bit, it's some backing, some going, some backing. So echo is doing so with the waves. So and the anechoic is like the fluid. So on the top you can see here, I'm gonna open a little bit to don't be too dark because your eyes is gonna hurt after. So you can see here the bladder on the top. So it's black because we have urine inside. So the wave is gonna go through and wave left. Okay, so it's not gonna doing echoes. So it's black. Here we have like a black situation too. But you can see here like the round form, white dot, like very white form. So this is the shadowing material, like something very hard is there. So we're gonna, the wave is gonna pass, no, it's gonna poof in back. So it's gonna make me like the shadowing, that's something it's very hard inside. Okay, and here, What is
It's
this?
through the clouds.
what is this?
This reverberation,
Reverberation
yeah,
about the
the gas.
gas. So this is the gas. You see? This is the reverberation. Look at this, it's so cute.
It works.
You know, the images talk. So this is so cool. So this is the stomach with gas. So we can see here the stomach, like we can see the, you know, the membrane,
The membrane,
the mucus, like the wall here, and we can see the gas inside. So the gas, the waves like going there and like, you know? So this is something here. What do you think it is? It's very, very hard.
foreign body?
It's very, very hard, or it's there is a shape over there, or no? There is a shape, and it's very, very, very hard. So it's not a fluid because it's compacted there, correct? So if you see, there is something there. This is our fine line. So okay, so it's a small toy. So this is easy for me. When the ultrasound is, for me, it's fantastic to do the ultrasound because I'm like, okay, let me find it. I think it is like a corn cob. It's a corn cob. So yes. So the radiographs, tomography, and ultrasound in summary is this, like to you understanding. So radiographs, you use radiation. We spend about 10 minutes to perform. It's easy to perform. The majority of the cases are easy, right? The interpretation, it's the majority of the time we have a lot of experience with the radiographs, so we can understand, and the cost is low. So we can choose radiographs. Sometimes, yes, we can, the majority of the cases, we're gonna choose radiographs. So the thing is, when I have to choose other kind of imaging, I usually say one sometimes complete the other.
Or compliments the
They're
other. That's
complements,
fine.
yes. So sometimes we have to use both. Sometimes it's necessary to use both. Sometimes I can't see totally in the radiographs there is a foreign body or not. I have to choose the ultrasound to help me. So sometimes I don't see the fractures inside the skull. So I have to choose to do, you know, like if the owner wants to do surgery or not. So I have to do CT too. So this is something important that we have to explain to the owner too. So sometimes I need both to do a better diagnostic for you, for your dog, for your cat, and to try to understand. So the CT, usually we spend 30 minutes doing the CT. Now the performance is sometimes very easy, but sometimes not. So this is something like we can expect. The interpretation, unfortunately, we need someone experienced to read, and the cost is a little bit like high than the radiographs. And the ultrasound, if it's not the T-FAST and the A-FAST, that the cost is very low, like during the emergency, it's very similar to the radiographs.
It's way cheaper.
Yes, a
Yeah.
little bit more, right?
No,
No, it's-
the radiographs are like 400, and the T-FAST or A-FAST is like $90.
Yeah, sometimes you can do the ultrasound, the T-FAST or the A-FAST to help, you know? And the ultrasound to performance generally is very easy when you have the training, of course. But the T-FAST, it's something that we can like teach, we can learn. Like this just to perform and try to do the triage thing. And interpretation usually it's not like, it's like kind of radiographs too. So we can like have like a lot of people like knowing about. So and I can help. And the ultrasound, the cost it's in between, I think. In the
It's a
CT.
little bit more than X-rays.
Yeah, it's
It's
more
not-
than that. Yeah, it's more
It's
than
more
the.
than X-rays, but definitely
It's
nowhere
more than
close to the
X-rays,
CT.
but it's not the CT. It's in between CT and ultrasound. Okay. So here is the final example to you. It's the same patient using the three kind of images. So just so you have an idea, it's a lot of fluid here or a mass here. I don't know exactly, but it's something here in the thorax, correct? So we can see the bones here, but we don't have sure about what is going on. We have like to help with like the ultrasound. Okay, so let's go to the ultrasound. Simone, can you put the ultrasound there? Yes, I can. So go there and like, oh my gosh, it's a lot of fluid. It could be an abscess, or it could be just a seroma, or a mass with some like necrotic fluid. So here we can put a needle here and collect this fluid. Yes, we can. Okay. So we don't have like the answer still. So what we're gonna do? The CT. So the CT, we have like the answer, then we have like the abscess here, and we have like a lot of no, mild involvement like in the tissues, the bones. So this is something very important that we have to be very honest with the owner and be, okay, probably we have like osteomyelitis or something like that. We can have like the cancer too. So, so the surgery here, it's a different prognosis, right? So this was I planning to present for you guys. So I think if you have questions, I can answer. And it was my pleasure to be here to help you guys.
Thank you.
Do you have some questions?
Do you actually teach classes?
Yes.
Next time.
We're planning to do that, right? We are starting now. Now it's my first time speaking, so I'm training to do a training, like especially when we have like the T-Fast and the A-Fast, because it's easier. It's much easier and very useful. So we're gonna plan that too. So yes.
Nice.
Yes, and next year maybe I'm gonna do my test to my certificate
For America.
for America.
Yeah.
So
Yeah.
good. So yes, thank you so much, guys.
Thank you.
And if you have doubts, if you have questions sometimes about the lab, which one I have to choose, if you want, like, just call me. The guys like can like, Simone, I have a case like that, and I don't know what they recommend. So do you think it's gonna be easier to do a CT or radiographs or ultrasound? I can help you guys, or email me too. So please, the guys like in front office like can send me an email. I have my email too. So if you want, just be comfortable to ask me if I can help. I can help.
Thank you.
Thank you so much.
You're welcome. You're welcome.